As women, we juggle many things, as you all do. It may be a young girl, it may be an adult woman or an older woman. We all take on many different roles. We are a daughter, we are a wife, we are mother, grandmother. We could be playing any role, and this is just in the home front. What about work or study? You are a student or a working woman, and you could be a boss, you could be anything you want. So there's so many aspects that a woman is juggling. So sometimes during this act of juggling, we don't know if what we are feeling is normal or abnormal. And as said before, sometimes these feelings may be associated with the normal process of the menstrual cycle. So I'd like to share an experience that we had this morning, and maybe many of you may want to relate to this. As students, you all go through the pressures of exams, peer pressure, and wanting to have a social life. I get it, it's really, really hard. But it is also important, if you do struggle with any of these symptoms, you seek appropriate help. Make sure it is not something that you need treatment for. In the given context, I'd like to share the story of a teenage girl who presented with irritability, mood swings, anxiety, poor sleep, abdominal pain or tummy pains, bloating, and diarrhea. Now, these symptoms could be physiological, stress-related, or cycle-related, or something more sinister. This is where help is required. So we asked more questions to figure out if this is normal, as in, is it just a part of growing life? Because as young women, you face a lot of pressures. There's stress related to your general life, your school or student life, and there's peer pressure and social life. So there's lots of pressures. So these symptoms could just be part of experiencing life itself, or it could be related to the changes in the hormones that are following the menstrual cycle. So in a situation like this, we asked more questions regarding when this occurs. Is there a pattern to the occurrence? So the young girl mentioned that this happens mainly in the second part of pre-menstrual, before the menstrual cycle occurs. So we asked the girl to keep a diary for a few months. We reviewed her and found that yes, these symptoms occur mainly prior to the menstrual cycle, and as the bleeding starts, these symptoms are relieved and she does feel that she's a different person. So coming to the conclusion of what is called as premenstrual syndrome. So let's learn about what is premenstrual syndrome. So it's very simple, premenstrual. So symptoms that occur prior to the menstrual cycle or on the first day of the menstrual cycle. So as mentioned before, symptoms could be like mood swings or irritability, anxiety, or poor sleep, poor concentration, poor focus, or there can be physical symptoms like abdominal pain, pelvic pain, bloating, diarrhea, constipation, nausea, vomiting, or headaches. So they all contribute to the premenstrual symptoms. Now, some women experience this in a mild form. Some of them, it can be quite debilitating. So this is where you will need help or advice of a healthcare professional, so you can manage yourself accordingly. If it is severe, then there are options for treatment in terms of medical and non-medical. And I'm sure if you watched my videos before, I always emphasize healthy eating and exercise. So irrespective of where you are in your life, healthy eating never goes out of fashion. But please do your research on what suits you in terms of food habits. Exercise, at least 150 minutes of exercise per week is recommended. Whether you do simple walking, whether you combine it with a bit of weights, please do that though. That is really important, not only for your physical health, but also for your psychological health. So those two things will be your basis irrespective of where you are in the cycle. So the next few things that you can do is to avoid caffeine, avoid sugar. So they can also help with managing your symptoms. So combined with this, if you still need assistance, there is medical options that is available to you. So if you're at the point where you need medical help, please seek help from your own healthcare professional, or you can visit our website to book an appointment at athenawomensclinic.com.au. Thank you for watching.